My name is Leanna, and I want you to see me and see an F.
My name is Blake, and I want you to see me and see an F.
My name is Jayshawn. I want you to see me and see an F.
People who have NF are so varied in different types.
I basically tell them it's genetic disorder, can cause tumors to grow anywhere on or in the body, and it's like something that you're born with.
I look healthy on the outside, but on the inside I have over 100 tumors in my body.
But what people don't see with my diagnosis is that I'm losing my hearing.
They just see this person, oh, you're really in pain every day?
I have NF1. I'm the only person in my family that has NF.
They make assumptions that they're not just like every other teenager.
Because some people are different than other people.
Might see you as someone who's different, but actually understands you and knows a part of understanding of what you're going through.
All of my tumors are internal. I don't have any skin tumors.
One of the things people can't see about NF is the constant worry we have, knowing that a tumor could be growing anywhere in your body at any time.
I'm not too sure. I might develop tumors, I might not.
I think about the future and I get scared, but then I meet people within CTF and the NF community, and it's inspiring.
Just because I have NF2 and I've had 27 surgeries, despite these challenges, I'm still pursuing my dreams.
Someone could show a scientist, and then they could figure out a cure and keep on experimenting.
Although I have NF and I went through my own struggles, the second I found out my son had it, my entire world changed. And it was my mission from then forward to find a cure or an effective treatment.
The more attention there is to it, the more research, the greater chance they're going to find a cure.
We want everyone to support her and support everyone dealing with NF in the way we've felt so supported by the CTF community and the NF community.
My name is Jesse. I want you to see me and see NF.
My name is CJ. I want you to see me and see an F.
Hi everyone, welcome to our presentation this morning. We have a panel discussion about hearing concerns in neurofibromatosis type 2. My name is Heather Thompson. I'm a speech-language pathologist by training, and I'm here along with Ken and Ariel, and I'll have them introduce themselves this morning as we get started. Ken, would you like to start?
Is this on? Yeah.
Yep.
Good afternoon. I'm Ken Arcia. I am on the board for the Association of Late Deafened Adults, and I've been involved with them for almost 30 years. And I have NF2 myself.
Hi, is this on? Okay. Hi, I'm Ariel Kassar. I'm an audiologist as well as the Audiology Clinical Education Coordinator at Sacramento State University. It's my first time attending the summit and I'm having a blast. I'm so happy to be meeting all of you and to discuss hearing loss and balanced care. Thank you for having me.
All right, so we're going to get started. Our topic today is I've lost my hearing, now what? So we did some brief introductions and we'll get started on our content. It's our hope that at the end of the presentation, individuals will have more knowledge about resources for hearing loss for individuals with NF2 related schwannomatosis. We're also going to talk about technology options for managing tinnitus and hearing loss. We're going to talk about how to support communication beyond using technology, and how to modify environments to maximize communication efficiency. And then finally, we're going to touch on how to become a self-advocate. So we've got an exciting topic today, and we'll move forward with our content. So Ariel, do you want to start us off?
Yeah, sure. Right. So obviously my job as an audiologist is to perform the hearing assessment. So when I perform a hearing assessment, I'm working with an ear, nose, and throat physician to establish the best plan of intervention to treat any decline in hearing. So audiologists look for specific signs and patterns that might indicate the presence of NF2 tumors as well as the progression of those tumors. So it's very important for you to get a baseline hearing assessment, and it provides a reference point for any future comparisons to hearing, and allows us to track any changes over time. So regular monitoring allows for early detection of any changes in hearing and balance status, and early detection allows for early intervention and treatment. So you want to do this as early as possible, so that way we know the best plan of action, whether that's to recommend amplification in the form of a hearing aid, and we'll go more into that in detail as we go on. It's also important to note that, listen to your friends and family. If they're telling you that you're not picking up things and you're missing information, then it might be time for you to get a hearing test. Sometimes our loved ones are the ones that catch the hearing loss before we do. So it's really important to get your annual hearing assessment. Even if you might not think you have a hearing loss, just due to the nature of this diagnosis, you want to keep up with hearing assessments.
Yeah, absolutely. Thank you so much. So one of the things that we want to do is talk a little bit about the scope of practice of an audiologist or a speech-language pathologist. So certainly audiologists are responsible for providing assessments and intervention for concerns related to hearing, but also balance. They provide care for the prevention of hearing loss. So I think of, in our population of individuals with NF1, NF2-related schwannomatosis, and schwannomatosis, we know that there's an increased risk of hearing-related concerns in these populations due to the inherent symptomatology of NF1, NF2-related schwannomatosis. But we also are exposed to things in our environment, noise, other things that are also can create hearing concerns, and so it's important for us to be aware of that. An audiologist provides assessments for oral rehabilitation, whereas the speech-language pathologist, we provide the treatment, and so speech paths can provide intervention for oral rehabilitation, which is essentially learning ways to improve communication efficiency in light of hearing-related concerns. And then a speech-language pathologist will also provide intervention for multimodal communication concerns. All right, and I just want to give the definition of oral rehabilitation before we move forward, and it essentially is restoring or optimizing an individual's participation in activities that have been limited as a result of hearing loss. Okay, so technology.
Yeah. Before I go into technology, though, I did want to add that as an audiologist, although we don't exactly do exercises for oral rehabilitation, we can definitely give you resources to utilize, online platforms that will help with your amplification, because it's a twofold street, right? You need the amplification side of it as well as the oral rehab side of it. Your devices are nothing without you being able to know how to use them effectively. So with that, I'll go into the devices that we use to treat hearing loss. So there are three main devices that we as audiologists prescribe. So hearing aids, which amplify sounds to improve hearing and speech comprehension. These are suitable for individuals who have a fully functioning organ for hearing called the cochlea, and relatively normal pathway to auditory pathway up to, to get sound up to the brain. So the next step for a hearing aid, when a hearing aid is no longer appropriate for an individual, would be a cochlear implant, which is an electronic device that bypasses the organ for hearing, and it stimulates the auditory nerve directly. So there are three major manufacturers worldwide for cochlear implants. As I said in a previous talk, for anyone who's heard me speak at the summit already, they vary in product range, but they're more similar than they are different. So, don't get caught up in which one to choose, because each will give you benefit. It just depends on the features you're looking for. And your audiologist should be able to go through each of those features with you. So lastly would be an auditory brainstem implant, which is the last step technological practical-wise for managing hearing loss. And this is used when cochlear implants are not an option due to the function of the auditory nerve being compromised. So it bypasses that auditory nerve and it stimulates the brainstem directly.
Yeah, excellent.
So a big part of hearing loss, a big proponent of hearing loss is tinnitus. I'm sure everybody's heard of it, maybe called ringing or what have you. But I do want to highlight that tinnitus is more often a symptom than it is a standalone condition, although it can be, but it is most often a symptom of hearing loss. So let's define what is tinnitus. So tinnitus is the perception of sound when no external sound is present. It is subjective and it differs from person to person. So your tinnitus might sound like a buzzing, a hissing, a whooshing, a roaring. It could be pulsing towards your heartbeat or just pulsing in general. So it can really vary. You can have different sounds that coincide together. So it's really important for you to be able to describe that to your audiologist when you're talking with them, because they can tailor the management based off of what you're describing. So we manage tinnitus through something called tinnitus retraining therapy, TRT, which is an individual management plan for those experiencing bothersome or debilitating tinnitus. So even if tinnitus isn't bothersome to you or debilitating where it's affecting your quality of life, you can utilize white noise machines, apps. A good one that I usually recommend is the Widex Zen app, and I'll be able to put resources in the Hoover app for anyone who needs that. But usually with tinnitus retraining therapy, our goal is to provide habituation of sounds in the form of tinnitus maskers and psychological therapies to help treat tinnitus. So we'll go more into that.
Excellent.
Yeah, so in regards to technology to manage tinnitus, as I mentioned some apps before, but a major factor in treating tinnitus is also treating any form of hearing loss that you have. So your audiologist will more than likely recommend hearing aids, particularly if you have hearing loss. Sometimes we even recommend hearing aids when you don't have hearing loss. Usually, when you're getting a hearing assessment, we test up to a certain pitch, but when you're doing a tinnitus assessment, it's important to test beyond those standard frequencies or pitches. So we go throughout the whole frequency range. Humans can hear up to 20,000 hertz, so usually we test up to about 18,000 hertz just to see if there's any deficit there, because that usually can indicate why you might have tinnitus. So that's also important to note as well when you're going to the audiologist. Ask for a tinnitus assessment specifically, because we do a little bit more in-depth testing. Another manager of hearing loss in terms of technology is something called neuromonics tinnitus treatment, which is a sound-based therapy that utilizes customized music personalized to the user's degree of hearing loss, including the ultra-high frequencies, as I mentioned. The treatment is administered through headphones for several hours daily. Most of these treatments you'll hear me talk about, they are going to be utilized for hours on end, because the point of tinnitus retraining therapy, as I said, is to habituate you. So the more that you're exposed to masking the tinnitus where you're not thinking about it as much, the more your brain is kind of tricked into not focusing on it, so that it's not as bothersome to you. And that's the main goal of any sort of tinnitus retraining therapy, is to train your brain so that you're not focusing on the tinnitus, but rather you're able to ignore it, and so it's not as bothersome. So another one, I'll just go through these really quickly. Again, like I said, the resources will be on the Hoover app. So notch sound therapies. This can be used with certain types of hearing aid amplification or with filtered music. This therapy involves not amplifying the frequency of the tinnitus in a hearing aid or filtering out frequency in music. So this approach has shown a reduction in neural activity related to tinnitus that can help reduce tinnitus bother. Again, we're really just trying to trick that brain as much as we can with different methods. And lastly, I'll just touch on bimodal stimulation. This is one of the newest forms of tinnitus therapy that's out there. It combines sound therapy with other sensory stimulation change in the neural pathways in the brain, which relates to persistent tinnitus.
Thank you so much. All right, so let's talk a little bit about communication in general. And when I think about communication, I like to start with a theory. I like to start with a model of communication. So when we're interacting with another person, communicating with them, so we have a conversational partner, on the left-hand side of the screen, this is where we have all of our input, and this is where we're receiving information. And because our talk today is focused on hearing, that'll be our primary modality. But I want to express that there's a range of communication options for efficacy. So input is anything that we're receiving, any information we're getting. And we can receive communication through the visual modality, by watching, by being an active listener with our eyes. Of course, we have the auditory modality, like listening with our ears, but we also have gestural communication, and I don't want to underscore the importance of also communicating using gestures, okay? Like touch to get someone's attention, or those kinesthetic cues, like waving to get someone's attention. We want to have like a holistic way of communicating to as much as possible, so that input is important. Similarly, when we're communicating, there's also the output, and that's how we're producing information. So we can write, we could text, we can speak, we can also gesture as well to communicate. And so in the middle of this input and output is where we do all of our information processing. And so we develop a speech motor plan, and in individuals with neurofibromatosis, NF2-related schwannomatosis, sometimes there's facial weakness that can also impact our ability to communicate. And so we want to make sure that we're making communication as effective and efficient as possible, and that information processing is happening. So when we're preparing for a diagnosis of hearing loss, it's important for us to think about multimodal communication, like using all of your resources and communicating in every way possible. Sometimes using multiple ways of communicating in one communication exchange so that our message can be received effectively or produced effectively. So that's just something I wanted to start as we go forward and continue to talk about hearing. So when we talk about a communication disorder is an impairment somewhere in the ability to receive, send, or process information, either verbally, non-verbally, or using graphic symbol systems. And it can affect either the input or the output, and it can be mild to profound in terms of severity. And it can impact individuals across the lifespan. And there's also things that we can do to compensate or find accommodations for a deficit in an input or an output. Okay, so multimodal communication, I had the chance to present this slide last year when I was working with Tina Childress and Matt Hayes as part of our NF panel here last year, and so I just wanted to bring it back to refresh. Also, because we have a number of new folks here, I'm going to talk about multimodal communication. So it basically refers to communication using verbal, gestural communication like sign language, or kinesthetic information, as well as different types of augmentative alternative communication. Augmentative alternative communication is using things like devices and technology to facilitate, to make communication easily. And we use these even if we do not have a hearing, or even if we're not hard of hearing, we use technology every day. Like I don't think I go anywhere now without my phone. Who's with me on this? Right, and there's Live Transcribe, there's Otter, there's other speech-to-text technology we can use. We also can use videos and other visual supports and technologies to get our information communicated to conversational partners. So things that are examples of multimodal communication include things like talking and listening while using an implantable or a hearing aid device technology, as well as using a speech-to-text app at the same time. So you're using multimodal communication strategies to make it easy. Or another example might be using a tactile alarm like a shake awake, or you can use like a monitoring device like a Fitbit or an Apple iWatch, and I don't have any investments in any of those. I'm just saying, like, this is a technology, something like this you might be able to use to help alert you to various things. And I think if we just all incorporate these multimodal technologies into our life, then if a sense goes missing, like we become hard of hearing over our lifespan or we lose hearing, we're not relying only on auditory modality because we've already built in another way to be alerted or informed, and it's just so natural because we've been using it for 10 years. And so I think if you can craft your life so that you're getting information multimodally, we just want to make things easy, communication easy. Okay. So another example might be using a text-to-speech, or if you have a visual concern as well as an auditory concern, using a braille-to-speech technology to get that written modality to understanding, as well as using a hearing aid or an implantable device at the same time. Okay, so those are just a couple of ideas. Okay, so now I'd like to turn it over to Ken.
Thank you. Going back to when Ariel was talking about tinnitus, for myself, when I had surgery to remove my acoustic neuromas 40 years ago, when they cut the auditory nerve on my left side, I am completely deaf, and so a hearing aid or a cochlear implant will not help. But I do have constant tinnitus. I've had that for 40 years. So the only way that it doesn't drive me crazy is if I put on my cochlear implant so that it masks, my brain is focused on what I'm hearing instead of the tinnitus. So like you talked about, you have different ways of distracting yourself from that constant noise. Anyway, talking about communication tools to consider. When you live with a hearing loss, it's going to take some adjustments. Some people may investigate a hearing aid or a cochlear implant or an auditory brainstem implant. Myself, I have a cochlear implant, and I'm one of the very few people with NF2 that was able to benefit from a cochlear implant because, as we know, most of the time it damages our auditory nerve. So I had a hearing aid for 30 years, and it wasn't until about 5 years ago that the cochlear implant, well, actually the ENT, my ENT said, "Have you thought about a cochlear implant?" I'm like, "Yeah, for 30 years I've thought about a cochlear implant." And he said, "Well, nowadays the criteria is more relaxed, and that my hearing has been stable for the last 10 years. So they said I may qualify for a cochlear implant." So I went and got an evaluation, and I got one. So it's a great help to me in hearing sounds. Speech, I get about 50% on what's called speech discrimination. But it's better than with my hearing aid, I had 0. So, there are different things to think about. My sister, who also has NF2, she had an auditory brainstem implant, and she had that for a couple of years, and it wasn't really a benefit for her, so she tossed that. So she's completely deaf on both sides, and she does not use any assistive technology. It's amazing to me that she does so well at communicating. A lot of people will rely on their friends or family to help out when they're communicating. Some will use the latest in technology. I was really happy to see that when I got here, And I met with other people with NF2 at, like at a breakfast table or at lunch, and everybody quick to whip out their phone with their speech-to-text app. So I'm really glad to see everybody is aware and using that. Other suggestions, I myself chose to learn sign language. Some people may want to pursue that. You can also use oral rehabilitation, listening devices and technology, auditory-only speech, perception, and auditory training. You guys, one of you will be talking
I'll be talking about that in an upcoming slide. And then communication strategies.
Lip reading, speech reading. When I first got my hearing aid 30 years ago, my audiologist gave me the test, or they test to see how well you understood what's being said on the other side of the booth with no sound. And she said, well, you got 80%, so you're very good at lip reading. Well, why is that? I mean, I never had any training or anything, and she said, well, some people can just pick up on that. So I'm very fortunate. Now you have to understand, that is the number one question you will be asked whenever you tell somebody, I'm deaf. And then, oh, can you read my lips? I'm like, so. You're putting the burden of communication all on me. So let's try to work together, writing, gesturing, whatever. Yeah. Other communication strategies, like you mentioned. So these are all different options.
Thank you.
Yeah, so I think that's a good transition into, when we want to think beyond the technology. So some resources to utilize beyond the tech are oral rehab, which we've discussed in detail, which focuses on strategies to enhance communication and create an inclusive environment. Counseling is another tool that I think everybody should utilize. Audiologists, we often sometimes consider ourselves marriage counselors as well. If you come to the hearing assessment with your spouse or partner or just family members, we're often trying to help you to come up with ways to communicate with your loved ones and address those concerns across the board from everybody's point of view. So it can be a great tool to gain knowledge about your hearing loss and its subsequent management. It can also encourage self-advocacy, finding ways to include your friends and family to be more mindful about your communication needs. And audiologists also work with psychologists who can help individuals navigate the emotional impact of a hearing loss through approaches like cognitive behavioral therapy. That's a huge one for tinnitus, as well as pain management as well. So we definitely work hand in hand with psychologists as it pertains to bothersome tinnitus and your emotional well-being in terms of dealing with your hearing loss every day. Last but not least would be support groups. These are a great resource to provide a safe and supportive environment for individuals to share similar experiences and challenges, exchange coping strategies and receive emotional support. So please consult your audiologist about local resources, even if you're not near one. They can even maybe come up with their own small group with other patients that they feel have a similar situation to you and put you in contact with those people, and they'll maybe be the place that begins that for you. So speak up about your needs. Here's a list of some support groups that you may want to look into. So Hearing Loss Association of America, Say What Club, which is an online forum, Hearing Link, which is an online forum based in the UK, Association of Late Deafened Adults, and Sudden Hearing Loss Support Group on Facebook.
Excellent. All right, so oral rehab. So when do we start services? So there's a couple things to think about. You can access oral rehabilitation services if you're prior to a change in hearing status. So for example, I've worked in the clinic and had an individual access oral rehab with the anticipation that hearing may become a challenge in the future. And so as a result of therapy, I would target working on speech reading, lip reading, managing the environment to maximize communication. So it's strategies like, for example, let's say you want to go out for dinner. You can go at a peak time of the dinner hour. It's going to be really noisy. There's going to be, in a restaurant, there's going to be lots of clattering plates, lots of background noise because it's an increase in traffic. You're going to have a lot more to overcome communicatively in such a situation. Or you can develop the strategy of, we're going to go out for dinner in an off hour. Maybe we go at 3:30 in the afternoon, or maybe we go later in the evening and have dinner at a different time when it's quieter. So thinking about just modifying things to make communication easy and effective, and then getting in the habit of doing that, so that it's not a tremendous change if you have to then think about modifying in the face of a hard of hearing situation. You can also do oral rehab when transitioning to a new device. So you're going to get, maybe you're moving from a hearing aid to a cochlear implant. The hearing context is going to be different. You're going to need to learn different skills, different strategies. So you might do a period of oral rehab to help you adjust to the new device, to get you comfortable with it and get you using all of the new technology that goes along or comes with the device. So for example, I had one person in my life got a new hearing aid. And along with the hearing aid, he got counseling and support on how to use the aid, which was fabulous. And he also got this nifty device that would then connect his TV directly to his hearing aid. And the TV device, what happened? It sat in the box for like 6 months because he just needed that additional support of how do you connect that device. So, sometimes you get a new device, you're like, okay, I'm all good, I got my hearing aid, but then there's the other accoutrements that go along with it. And we want to make everything just easy, right? So that might be a place where going back and getting those additional appointments to help you be fully integrated might be helpful. Or you can get oral rehab when a change in hearing takes place. So you notice a loss or a concern or difference, now it might be time to go back and see your audiologist and speech-language pathologist. Okay, so what does oral rehab involve? Listening devices and technology, auditory perception and training, speech perception and speech reading training, and communication strategies. Okay, so auditory only speech perception and auditory training, what is that? So we know that hearing loss affects speech recognition, especially in the presence of background noise, and we know that listening is more effortful for individuals who are hard of hearing. So the goal of auditory training is to develop patients' ability to recognize speech, like lip reading, but it's a little bit more involved than lip reading. It's involved in recognizing the whole context and using all of the contextual cues to maximize communication efficiency. And it's used in conjunction with amplification or other types of technology. There's two forms, there's analytic and there's synthetic. And analytic focuses on recognizing or helping individuals to recognize individual speech sounds. So like if I were to say the word pop, you would look at my lips and look for the gestures and the lip speech reading, right? Or if I could say top, it's going to have a different, and I'm so sorry I'm so far away. Top and pop are going to have different mouth movements. And so it's about training individuals to learn to speech read using those, with those different mouth movement contexts. Okay, synthetic emphasizes understanding of meaning. So getting kind of the gist of the conversation, not looking at individual articulation components. Does that make sense? Okay, excellent, thank you. All right. So then lip reading versus speech reading, what's the difference? Lip reading involves a person only using visual cues, so just looking at lip movements to understand, whereas speech reading uses auditory and visual signals, gestures, and other context cues, okay? There's several factors that impact lip reading. One is how visible sounds are. Like there's some sounds that appear at the back of your mouth. Like if I were to say k or g, right? That's different. So if I say, let's see, I'm trying to think of an example off the top of my head. I'm gonna skip on that. Some sounds just appear at the back, like K's and G's and ings. Some sounds that appear at the front of the mouth are highly visible, like F, F or B, because your lips come together. So that's the point. The other one is the rate of speech. So if I speak more slowly, it's likely going to be easier to understand than speaking very quickly. Visemes is another one. So the shape of the mouth of an M and a B is almost the same. Super confusing. So if I'm saying mom versus Bob, that's going to be hard to lip read. So there's some contexts that are going to be more complicated. And then co-articulation of speech sounds is when two speech sounds are produced together. We see this a lot in what we call blends or clusters. Like if I say sling, the S and the L, if you can do this in your own mouths. If you put your tongue up to make an S sound, feel where your tongue is in your mouth when you're making an S. And then feel where your tongue is where you're making an L. In sling, you're almost in the same spot. Super hard to speech read. And I'm sure our audiologist would have more information about this as well. So I think the main thing is to, connect yourself with the oral rehabilitation therapist, and then engage in the therapeutic process, and then practice. And then also be really patient, because it's not always intuitive. You're not always just going to get it right away. But our goal as practitioners is to make communication as easy as possible. Okay? All right. Okay. Ken, back to you.
Regarding speech reading or lip reading, one thing that we used to teach in the coping skills that I had was that if you're not understanding something, you can ask the person to repeat, of course, but then you may say, let's say you heard 80% of the sentence, but you missed the last part. Then say, I heard you say you're going to the store, what? Like if the person said, I'm going to the store tomorrow to buy some beer, you say, I heard you say you're going to the store, so that they don't have to repeat the whole sentence. Or if they're still not getting it, you can have them rephrase it a different way. Okay, so I'm going to buy some beer tomorrow, so you say that in a different way. So that can maybe help you understand. Regarding living with hearing loss, it's going to take some adjustments, as we all know. Some people will check on a hearing aid or a cochlear implant or even an auditory brainstem implant. Some will learn sign language, some will rely on their friends or family, and others will use the latest in technology. One thing we were talking about, when you suppose, I used to have a hearing aid, like I said, for 30 years, but it's not like the new hearing aids or like my cochlear implant. My cochlear implant has Bluetooth, so I can listen to music from my phone or my iPod or something, and it goes directly to my cochlear implant. My hearing aid didn't have that. Also, when I got the cochlear implant, it comes with an app. So each situation, like in this room, I changed the setting so what I'm hearing is a little bit different than if I'm talking to somebody outside, So you have to get used to the different changes in technology. You can use some or all of these suggestions. One other thing was that when we were talking about technology, suppose you mentioned, I said, suppose you're using like a timer at home when you're cooking something. I have a timer that, I use it on my phone, so it's connected to my Alexa, which is connected to my lights, my lamps. So I said, Alexa, set an alarm or a timer for 20 minutes. Then when the timer goes off, my lights flash because I'm not going to hear the timer. So that's another way to use technology. Some things I wish I knew. When a person experiences a hearing loss with NF2, from NF2, there's a lot that they don't know what they don't know. They may, as they progress in their learning about their hearing loss, they may learn about different technology and things, but also they may learn they need to learn how to advocate for themselves, asking for things that they are entitled to. I mean, first I want to apologize for the video that we watched at the beginning of this session. There was no captions. So I went up and asked about that because I know I saw this video yesterday and it had captions. So they apologize if there was a technical problem. But I'm not just going to sit there and, okay, no captions. I want to go find out what's wrong or try to fix it, you know what I mean? So that's something that you will learn also as you learn how to advocate and speak up for yourself. You're going to learn more about support groups. Like Ariel mentioned, also those support groups can be in person or online. You're going to learn when you're talking with your audiologist or your ENT or your primary care doctor about if your hearing loss is permanent and if it will degrade, if it'll get worse. You can learn more about technology, like we mentioned, smartphones, captions, things like that, and communication tips. I uploaded a document, PDF, with some communication tips. And also, we'll talk about that in the next few slides. Support groups are really a vital resource for most of us. First, I want to ask you, how many of us are on Facebook? Okay, most people in this room, anyway. So we're familiar with support groups like AA or 12-step programs, therapy groups, things like that. When you're going through a challenge such as adjusting to your hearing loss, family members and friends may sympathize with you, but they don't always know what to say or the best ways to help. So support groups are a vital resource because you get to meet somebody else who's just like you. And so they may be going through a lot of the similar things you're going through. And sometimes it's important to talk to somebody and it's like, how do you handle this situation? Or what do you do for this? You know, that's really important. Some examples of support groups for those with hearing loss, as you mentioned, Ariel, ALDA. So if you want information about ALDA, you know, stop by afterwards after this and I'll give you a brochure. This is for people who lose their hearing later in life. There's also the Hearing Loss Association of America, HLA. Facebook, you can do a search for hearing loss or hard of hearing. There's also NF2 groups, as most of us know, NF2 Crew, NF2 Just Us. It was pretty cool. That NF2 Just Us is that. It's only those with NF2. Sorry. It's not their spouses or family members or anything, because sometimes we want to talk or we want to vent or just want to talk to somebody who really gets what we're talking about. Most support groups are available both in person and many online. Maybe you use Zoom or Microsoft Teams or something. If you don't find something local, then it's probably available online. If your audiologist determines that a cochlear implant might be better than a hearing aid, you will need to have your auditory nerve tested to make sure it still functions well enough for a CI. Like Ariel mentioned, there's 3 different CI manufacturers. Each has different features and options, and those are Advanced Bionics, Cochlear America, and Med-El. You can check their websites for each of those manufacturers. As you adjust to hearing loss, you can utilize many types of technology. And, some suggestions are using your phone. Like Heather mentioned, who doesn't walk around with their phone? We're all attached at the hip, right? You can learn about different accessibility settings. I would think I was showing Nick or somebody yesterday how to set up captions on your phone, because Android phones use live transcribe, Apple phones use live captions, but both are available under the accessibility settings. And then also you can use different apps like Otter or Ava, or there's a multitude, but most of those are not free. So only the ones that are built into the operating system are usually free. Let's see. You can use relay services. Actually, full disclosure, I work for T-Mobile, the phone company, the mobile phone company, and I work in the accessibility department. So we provide the relay service for about 38 out of the 50 states. And so you can use, if you need to make a phone call, you can use relay service to make that call using your phone. Most of them have an app available now. Also, things like caption that lets you speak normally to the other person, but what the other person says you will see as text. I myself tend to use video relay service because I'm connected with a sign language interpreter because I'm fluent in sign. But if you're not fluent in sign, you can use the other types of relay services. Next slide. Captions on TV or on movies. Most of us with hearing loss, or actually many people with hearing loss, or maybe people who are learning English as a second language, they rely on the captions. And ever since 1990, when the law was passed, all TVs built 13 inches or bigger include captioning, closed captioning built in, so you just turn it on. And also, if you want to go watch a movie with captions, many theaters all over the country are now provided open caption movies. So you can check the website and see when a movie is showing with open captions. Those are different than movies with closed captions. Open captions, you just sit back and watch the movie and it has the words on the bottom just like your TV. And then if you don't have that, you can go to most theaters will have closed caption devices like Captive View or maybe the Sony glasses, so then you can see the captions that way. Let's see here. If you have some residual hearing, you may want to use an assistive listening device. You can ask the theater for headphones, or some will allow you to plug in your own neck loop that may work with your T-coil in your hearing aid. And so you can use that at the theater also.
So, like I mentioned previously, we want you to start thinking multimodal now. So, parents, if you have kids at home who may be experiencing hearing loss or hard of hearing status, or you've got loved ones, just turn the closed captioning on right now. It's better for everybody. Like when we think about multimodal, it's just something easy that we can do. So neither I nor my husband are hard of hearing, but we use captioning at home. It's also great if you want to multitask. I think it's also important to stay up to date with current events and topics that are likely to be discussed. So say you have friends, you're going out for dinner, it's maybe in a less than ideal communication setting. Maybe you're at a restaurant where it's really loud. If you know what topics are likely to be discussed, like current events, things that are happening in news or entertainment in advance, then you need fewer cues to help you to know what's going on in the conversation. If you can kind of brush up on things that you know are likely to come up in conversation in advance. Another strategy would be to sit with your better ear beside the person who's speaking and be advocating for yourself in a preferential seated position. So you're out with people, you want to make sure that you're sitting on your better side, with people on your better side. as much as possible, if you're at work, scheduling one-to-one meetings or scheduling meetings through Zoom, if you can get closed captioning as part of that Zoom mechanism automatically, you can ask at work for these types of accommodations and reach out to your HR departments as well to be proactive and ask for these things. And, you can also ask colleagues to take notes during meetings. You can also take notes, but if you miss something, then you've got your colleagues' notes to kind of rely on as well. So collaborating with your colleagues as well is good. And practicing these strategies while you have hearing is good, because then there's going to be less work to do later if you can expect a hearing transition. All right.
One of the things is that if suppose you're going to meet a friend at a restaurant, you may want to pick some place that's well lit and has carpeting and drapes instead of a hardwood floor, so the sound will echo less. And when you're talking, when a person without a hearing loss is talking to me or somebody with a hearing loss, some things to think about is that you want to make sure you're facing the person with the hearing loss and that the light is shining on you, not the person with the hearing loss, so that can understand your speech better. Don't talk from another room. I'm sure that happens often where somebody's yelling, "Hey, Ken!" I'm like, somebody say something? Yeah. I'm not going to understand somebody when they're talking from another room. They need to see each other, so to better understand. Let's see, speak clearly, slowly, but don't over enunciate, move your lips like this. Don't, thank you. Let's see. Sorry to see the font. Say the person's name before beginning the conversation, so then they can look over and focus on what you're saying. I used to have a coworker that would start talking to me, and by the time I looked at her, I would miss the first sentence. So I was trying to teach her to say, "Ken, hey, whatever." So then I will look and then start talking. Keep your hands away from your mouth. And if you're eating, chewing, smoking, etc., while talking, your speech will be harder to understand. Also, people with mustaches or beards, try to keep them trimmed so that it's easier to see your lips. Tips for a person with the hearing loss, like myself when I'm talking to somebody else: tell others how best to talk to you. So I'm going to explain to the other person. Pick your best spot, like I mentioned, quiet, well lit. Often if you're with your family during the holidays, it's important for you to communicate with them, pull them aside, go to a different room, go for a walk together, instead of trying to understand everybody at the table. That's not going to work. Pay attention to the speaker, look for visual clues, people are pointing or, gesturing. Ask questions or ask to write it down if you're not understanding. Ask the speaker to rephrase, like I mentioned. Don't bluff. That's the number one thing where people just say, Don't do that, because that causes a lot of misunderstandings. Consider using speech-to-text apps. I use mine every day. Anytime I go to anywhere that's somebody that doesn't sign to me, which is 99% of the community, right? I'm not understanding, I'll pull up my phone. And they're like, "Well, what are you doing?" Speak into the phone, please, so that I can understand you. I'm deaf. It's easier for both of us. Next slide.
Excellent.
So remember, hearing loss, it's a journey, and adjustments will always be needed. So all of our contact information is on, I think, on the very last slide. But make sure you contact us either through the Hoover app or email us. We have a little bit of time for Q&A or no?
I think we actually don't. Yeah. Thank you all so much. I don't know if you want to close out, Heather.
Yeah, absolutely. Thanks everyone for attending today. We're going to be available throughout our lunch, and I know we're just in between you and lunch, so we'll close out here. And thanks everyone for coming, and thanks to our panelists for your excellent information and for being here today.